the gland that secretes the lubricant during sex is blocked. Of course, it's blocked. And the whole point is that it's supposed to secrete during sex. But if it's blocked, then it means there is no means to get the secretion or to get the lubricant to make you enjoy the whole thing. Now, it makes it looks traumatic. It makes it feels like, do you really want to do this at all? And at this point, just bear with me. My name is Dr. Samuel Ologo, and I'm a board certified doctor from Ghana. So kindly bear with me. I have seen that a lot of people tend to, watch my videos, but they are failing to subscribe, like, comment, or share, even for others to benefit from the content. But just take a second, click on the subscribe button, comment, share to someone, let someone benefit from it. Now, today's topic is quite interesting because a lot of people are passing through it, but it has become something that is difficult to actually talk about. Yes, we will be talking about baffling cyst or baffling abscess. Now, what at all is it, and then why the interest at this point? So, I realized that a lot of people, from statistics, actually, from statistics, it shows that 2% of almost all gynecological cases in the hospital, or people who go, or females who go to see their gynecologist, actually incidentally find out to know that there is a battling cyst that has actually blocked their it has blocked the duct or the gland from releasing the lubricant into sex. Now, have you ever had this feeling and you didn't know what to do because he tried all he could? He's done it all, held you, done all the foreplays, and yet maybe after this video, you are going to you know, get lubricated. That will be after this video. Of course, if you stick to the end, you will understand what I mean and how to deal with this. So, battling cyst is actually a collection of fluid in a sac, and this sac tends to fill the duct that the battling gland, which is a small pea-like structure found in the lips of the labia. When I talk about the labia, I mean the lips of the vagina. So there are these tiny um, they are glands, okay, which are found behind the lips of the labia. And we expect that immediately someone feels, or the female feels like they want to have an encounter with a male, or they want to have an encounter, there should be a lubrication of the site. All right, there should be a lubrication, just like in men you see that slimy thing. I don't want to be mentioning huge words here. So you see that slimy thing, and then at the tip of the penis, then it will tend to lubricate the entire place. Now for females, we expect the battling gland, which is that peanut, just like a peanut. All right, the gland, that's the size of it, the peanut. So we expect that that also gets excited, okay, it gets activated and then tend to secrete lubricant fluid through it to moisturize the whole environment, or you know the whole place. Now, instead of it lubricating and then leading to the moisturizing of the place, it tends not to do that because the duct is blocked. Now, what are we talking about? I'm talking about a battling cyst or a battling abscess. So before we get to an abscess, it's actually a cyst that has gotten infected. Okay, so with the cyst is the fluid that has collected. Now, this fluid tend to block the tract, which means that the gland will lubricate, the gland will secrete its fluid with the intention of going to lubricate the environment. But the cyst collected in the sac is preventing the lubricant from, all right, penetrating or coming to the labia to moisturize the whole place. So you might be doing it, but it seems traumatic. It seems that you are always having sores down there. It seems like you are not ready. You know you want to do it. You know you want to have the sex, but you are unable to because the site is always dry, irrespective of the amount of touches, the number of romance, the foreplays that he does, or you put yourself into, yet still it's still going to be the same thing because the tract is blocked. All right, now the we have people who actually have this consistently. Let's take children or females less than the age of 20 out, because um, research has proven that the the gland needs to mature before it can produce or tend to act in that manner. So it takes quite a longer time for the gland to, mature. So 20 years, you are out. But this video is for everybody. Now, from the age of 50, where depends on your country and where you are listening from, where by menopause is termed different. Okay, when I say different age wise, okay, there are certain countries that is basically 50 years, certain countries is 55 years, certain countries they may even term it to be like 45 because of um socioeconomic status. All right, yes, going forward. So if you fall between the age of 20 to 30, you are the one I'm talking about. You are the one I'm talking about. If you are above this age, what actually happens is that during menopause, the gland shrinks. That is why you are not lubricating. Do you understand? If you are in menopause and you are listening, this is it. The battling gland has shrunk, and this is making you not able to secrete the fluid that you are supposed to fluid or the lubricant. So it's always going to be dry, leading to sores and etc., urinary tract infection, etc. But what you need, if you are above that age, what you need, or if you are in your menopause, what you need is actually a hormone replacement therapy, such as an estrogen, whereby you can get a cream, estrogen cream, just to moisturize the place. Okay, that is for those there. Now, let me talk to you. 20 to 30. This is what is happening to you. It's dry because the gland is blocked. We've settled that score. It's 2% of all gynecological cases, and 20 to 30 years people, you are those who actually encounter this. What are some of the common things that will make you know that you are having a battling cyst? I told you that battling abscess is actually when a cyst gets infected. It means that an untreated cyst leading to the abscess. So a battling abscess. All right. So let's talk about the cyst, because when we understand the cyst, we know that that is what is linking us into the abscess. What would you see that you'd realize that I might be having a battling cyst? So it's actually painless. So sometimes you don't feel anything. You might just be there and realize that there is a small tiny bulge. Okay, sometimes it's not too big because originally the gland is not big. I told you it's a peanut size. Okay, so a tiny, sometimes when you are washing, you may feel there is some bulge, okay, a little bulge at the area, and that makes you feel like there's something going on there. And there is this non-purulent discharge. Non-purulent discharge, that just means that the whatever fluid is coming out, it doesn't have any bad smell. Okay, it doesn't have any bad smell, or it's just normal, something like water or brownish kind of discharge that is coming out. And most often these things, people encounter them, people have them, but because it's not giving any bad smell, people think that It might be normal. Oh, it's after my menses. Oh, it's this, it's that. Yes, but please bear in mind that is one of them. Also, vaginal dryness. Vaginal dryness, I told you that when you are trying to get into the mood, you want to have sex, and then romance and stuff like that, you still feel that it's not enough. Like you are still dry. And that is a very big problem. That is a very big problem when you're encountering that. There's also discomfort. Discomfort is always there because what is happening to me? I don't enjoy the sex. It's not your fault. Well, you need to get to the gynecologist to get yourself, treated, or else it's going to break the home, and that is very bad. We don't want that anytime soon. Now, if it's a battling cyst, abscess, which the cyst has gotten infected, if it's a battling abscess, this is what you are going to encounter. There's going to be the same like the cyst, there's going to be a presence of a lump. So just like that, what you can feel it. Okay, you can feel there is something down there that is untouching. Now, there's also going to be smelly vaginal discharge. This time is smelly because it is infected. All right, the discharge that is coming out is infected, and so it's going to be smelly. Now, the next point is fever. Every form of infection most often comes with fever. You go to the hospital, you think, nah, today I'm not well, today I'm not well, just, I'm not well, I'm not well, but there is something underlying the I'm not well. So kindly check and make sure that is also attended to. So there is fever, there is redness and swelling. I mentioned of the swelling, the lump already, but there's redness. When there's an infection, obviously there's going to be that inflammation thing over there leading to the redness of the area. There's also pain during urination, when that's dysuria. When you are, you know, pouring out urine, there's going to be this burning sensation. It's painful sometimes, and that should notify you that there is something going on. When you have sex or you have an intercourse, the pain that comes out is excruciating. It's like a tearing pain. All right, you need to immediately go see your gynecologist because the answers will be provided by him or her. Also, there is discomfort just like in the abscess. So people, when you are feeling any of these things, rush, get on, see your gynae, and then something powerful can be done for you. What causes this whole battling cyst? What actually causes it? The cause is unknown. The cause is unknown, which means that the treatment would also be difficult. Are you getting the point? If the cause is unknown, then it makes it more difficult. Now, because it's unknown, you have to understand that you need to protect yourself well. Okay, you need to protect yourself well. There are perceptions out there, or there are researchers out there that states that ascending infection, that is infection from outside into the vagina, and then the body picks it up. Okay, so as it ascends, it begins to block the tract, making it difficult for the passage of the lubricant. So that is also one. So unknown cause, there is blockage of the tract that is supposed to allow the lubricant or the lubrication to come out. There is infection. Infection because abscess, 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 abscess. All right. And if you've had a vulvovaginal surgery before, that's surgery that has to do with around the vulva, the vagina, any surgery of such before, you're at risk. Okay. Let me go further into the risk factors. If you've not given birth before, you are sexually active, as we know already, the cause is unknown, which opens the bracket to a lot of things for us to think about. All right. So infection, previous battling cyst, which has gotten infected, um, previous battling cyst, which wasn't treated well, um, people who don't have safe sex, STDs, we have diabetes mellitus. Gonorrhea is there. I mentioned STDs and STIs. You know them already. So these are all things that you should pay attention to. Now, how do we diagnose this battling cyst? What will you do when you go and see your doctor and they tell you that, oh, this is what is happening to you? What is the doctor going to do? Is it going to be scary? No, it's just a matter of checking what is actually there. So a physical examination, the doctor is going to go through, um, is going to examine you to actually detect if there is something down there and has to be attended to. Also, there is going to be full blood test. Okay, I wanted to mention technical things, but I'm sorry, you know my channel, we go simple. So there's going to be certain laboratory investigations the doctor is going to perform. The doctor may want to also usually take, if there is discharge, they will take some cultures and then send it to the lab to detect which microorganism itself is causing that. And in that case, it means there's going to be the actual medication. Don't self-medicate. Don't self-medicate. So when you go to the hospital, your doctor will be able to sort you out. Now let's talk about the treatment. I'm going to give you the home remedy first, and then we go to the hospital. All right. When you are encountering any of these things I mentioned in the symptoms, all the things I mentioned, when you are facing them, when you are experiencing these things, relax, take your time. You can do what we call sit bath. Do you know sit bath? Sit bath is when you obtain, let's say, a bowl. Okay, let's not go too technical because it's a home remedy. Let's just do it like in the home. So you can obtain a bowl, you get water into it. If it's for hemorrhoids or piles, that's different, where you put salt and all those things in it. Do not douche putting things under the vagina or in the vagina and trying to neutralize the scent or smell that is actually coming out from the place and stuff like that. Don't do that. Just get a bowl. Okay, you can get water into it. Now the water is where the trick is. It can be a lukewarm water. When I say lukewarm, I'm trying to tell you that in between hot and cold is what? Warm. So you get water, just neutralize the temperature and then keep it there. Now you are going to sit in this water for about 15 minutes, 10 minutes, 10 to 15 minutes. That's the gap. Now you sit in this and then you just wait. You don't do anything. Just sit in it whilst you see what happens. The next point is warm compress. Now, because it's pain, it's a lump or it's a swelling, what you need to do is you can get a clean towel. Okay, clean towel. You dip it in the warm water and then you just put it on the labia, because it's the battling gland lies behind the lip of the vagina. So you just get a warm compress, you dip it in water, okay? And then you drop it there. You just put it there. You don't need to do anything. Don't push it. Now, if it's painful, then you need a pain medication. Now, that is the home remedy. I hope you didn't think I was going to tell you put this vegetable sauce. I won't do that. Okay, so just get yourself the set bath and then warm compress. That should be able to relieve you. Now, when you are relieved of the discomfort, the pain, and all that, your next shot is to go to the doctor. Now, the doctor, after the culture and sensitivity, taking some part of the discharge, will send it to the lab, and the lab result will come out, giving the doctor the information of which antibiotic should you take. That brings us to the next concept: antibiotic medication. So the obstetrics and gynecologists will put you on some antibiotics. Most often the antibiotics solves the case perfectly. Now, if it's an abscess, this is what happens. We call something fistulization. Now, fistulization is just making, we put a urinary catheter. Okay, we put a catheter The catheter is a rubber that we place in the vagina, or it's actually the urethra. Okay, I don't want to go deep. We pass it through the urethra so that it goes into the bladder to drain urine. I know you've seen it before, so let's go straight. So the doctor makes an incision and then puts the catheter in it to hold it, to drain all the fluid, because if you don't drain an abscess, it can lead to a fistula. A fistula is a communication between, let's say, this organ or this tissue and the other tissue. I'll come to the complication where I'll tell you about it. So the fistulization. So a catheter, the doctor places a catheter into it to drain all the fluid from it so that the tract will be opened for your usage. Now, the next one is actually called the marsupialization. This is actually making an incision to open the abscess, and then we suture the abscess, the walls of the abscess together, which means that it's now an open tract. Okay, prevent any infection, drains the site, clean the site, and then if the fluid is coming, lubricant, you'll be fully lubricated. So that is it. Now there are other techniques. We have the carbon dioxide laser therapy, where laser is shone on the, you know, swelling, and then it resolves. We have the sclerotherapy, we have the silver nitrate gland ablation. All these things are there, but they are technical. Don't go there. Your portion is to do the home therapy and then go and see the gynecologist. Now, complications. This is where it becomes massive. Now, we have what we call the recto-vaginal fistula. I was telling you about the communication between one tissue and the other. What is going to happen is that because it's an abscess that hasn't been drained, there is going to be a communication between your vagina and your rectum. Yes, your vagina will be communicating with your rectum. So any discharge that comes out, you can imagine, very smelly. And it's because it's not vaginal discharge, it's actually feces coming through your vagina. And that has to be solved. You wouldn't want to experience that. So that is one part of it. There is sepsis, where there is a whole lot of infection ongoing in your body. There is hydrouretus. That is because of the blockage is compressing. Okay, the blockage is down here, but it's preventing the ureter from the kidney. Okay, the ureter to drain for you to be able to urinate. So it's going to compress and block all those things. So these are some of the things you will be experiencing. Now, before I tell you how to prevent it, take 1 second. Just subscribe to the channel for more of these informative content. Now, how to prevent it? We prevent this whole thing by trying to save sex. Safe sex. If you are practicing safe sex, you are free. It's very difficult for you to experience these things. If you are not also practicing, then of course you don't know whether your battling gland is active or it's not. But of course, I expect it to be active so that it can lubricate whenever you want to, you know, be on form or perform. Also, surveillance. Surveillance is actually taking part in regular examinations, investigations. You give yourself out that every year I'm going to examine myself, and I'll allow the gynecologist to also check some of these things on me. And also personal hygiene. If you keep yourself clean, because the site of the battling gland is actually very close to the skin, so it means the least you are going to do might lead to certain infections. So thank you for hanging on with me, and I hope to meet you in my next video. My name still remains Dr. Samuel Ologo. It's a robust lifestyle just with me.